I recently did a video detailing the issues with prescription drug prices and availability in the United States. To recap a bit, the video detailed how costs could be lower and drugs could be easier to obtain in a free market system as opposed to the current bureaucratic mess imposed by the state. Medicine is a huge part of the healthcare field, but while that video was intended just to cover that specific topic and how to fix it, there's a lot more going on in the world of healthcare that has to be addressed if we want a conversation about any alternative that isn't a total government takeover, which sadly has the most momentum behind it considering the establishment wing of both major parties apparently have no intention of looking to capitalism or the free market as a cure to the ills of our failing system. To begin, we'll discuss what exactly the main issue seems to be in American healthcare. And that issue, of course, is cost. It's really an economic issue that has people dissatisfied with how the system works in the United States, and rightfully so. Most complaints of quality are related to administration and insurance, but the issue everyone is concerned about is the cost. So, not including the issues with prescription drugs, which I covered in a different video, here we go. These are the top 6 issues as I see it with the cost of American healthcare. 1. It's illegal in the United States to purchase insurance plans across state lines. It's banned both federally and statewide. This is a heavy restriction on the market, and by reducing competition, it drives up prices. This is an example of corporatism and cronyism, which only exists because the state is rigging the game in favor of those industries and corporations at the expense of us, the American consumer. 2. Employer-based healthcare insurance. To dig into this, we'll have to cover some of the unfortunate history of how this came to be. During World War II, with so many citizens going off to war, there came a heavy labor shortage. The economic concern was that businesses would, as the market demanded, raise salaries and wages to attract new workers. The powers that be thought this would cause inflation, and so FDR passed an executive order which established the Office of Economic Stabilization, which banned businesses from raising wages to pay their workers more. The result of this was to work around the new rule and offer other perks to attract workers. This is the beginning of health insurance being tied to employment. On top of that, in 1943, the IRS dictated that employer-based health insurance would be exempt from taxation, which made employer-based health insurance a cheaper option than getting health insurance directly from the market. So employer-based health insurance was heavily incentivized via tax credits by, you guessed it, the government. In 1940, only 9% of Americans had health insurance. A decade later, it was over 50%. And by 1960, that number had grown to about 2/3 of the country. Not only is employer-based health insurance an issue in losing or changing your jobs and thus losing your healthcare coverage, but it aids in driving up prices of both insurance and the care itself. Imagine having your homeowner's insurance or your car insurance tied to your employment. It just doesn't make any sense. In addition, when an employer provides health insurance for an employee, it comes at the total overall expense of employment. This means that that money goes into your health insurance instead of on your paycheck and into your wallet. 3. Health insurance is required for pretty much everything. Imagine having to go through your car insurance provider every time you had an oil change or put air into your tires. It would be tedious, expensive, and insane, right? Well, that's what we have in the current healthcare system. This also aids another major element, and that's a lack of price transparency. Imagine for a moment that the government has incentivized employer-based food insurance because food is a human right and people have to eat. Now imagine you go to a restaurant where there are no listed prices and instead of a check that you just pay up front, there's a waiting line at the cash register where the cashier has to validate and approve your food insurance to calculate your total cost of eating a meal. This sounds ridiculous because it is ridiculous, and it doesn't have to be this way, yet that's what the American consumer is subjected to in this joke of a system. Health insurance in a free market system would operate more like car insurance in the way that it is only necessary under severe circumstances. In a free market, healthcare would run like any other business, where prices are listed or at the very least easily obtainable upon request, and consumers could patron services based on the quality and price. Of course, this isn't always an easy option for someone seeking emergency care, but that's what insurance would actually provide for. Imagine the possibilities of a market where businesses would be free to specialize in providing certain services like MRIs, X-rays, CT scans, Specific types of transplants, procedures, you name it, without being restricted and complying with ever-increasing government red tape, which raises costs and stifles innovation. And I say health insurance is required for pretty much everything because it isn't required for elective care, such as LASIK eye surgery. Interestingly, in terms of elective care and procedure, which is not covered by insurance, the price trends are the exact opposite, with prices constantly declining. This correlates exactly with how the free market operates in other areas. When cell phones first hit the market, they cost thousands of dollars, and that was in 1980s dollars. Just to own those cell phones, it cost thousands of dollars, and the fees for the calls were outrageous. Today, you can buy a burner phone at Walmart for $20. The market incentivizes growing technology and reducing costs. But this trend is not reflected in areas with heavy government regulation and bureaucracy, like health insurance. 4. Licensing. The American Medical Association has a monopoly on licensing medical providers. Above all the seemingly endless bureaucracy in healthcare, in the medical profession lies a government-granted monopoly on the licensing of medical practitioners. This places a cap on the amount of certified doctors on the market, and as an obvious result, increases the cost of care. The average physician's salary in the U.S. is approximately $237,000 a year, while their counterpart in Europe is less than half of that. Similar to my video on how the FDA needs to be abolished, entirely privatized, or at the very least stripped of its monopoly power and forced to compete within the free market, the same goes for the AMA. Like the other above-mentioned examples, this wouldn't actually cost Americans anything to solve this problem, and it would drastically help to lower the costs of care. 5. Certificate of Need laws. And it wasn't until the coronavirus pandemic that I was even aware that this was an issue in some states. In order to open a hospital, you have to be first approved by the local government by making the case to them why your community would benefit from your hospital. As if that isn't obvious. This creates an unnecessary barrier to entry for new facilities and businesses and opens the door to government protection of previously established and connected health facilities. This is a method for shielding established healthcare facilities from competition. 6. Obamacare. Look, most of these problems existed long before the ACA was rolled out, but the ACA was the exact opposite of a valid solution. It has restricted coverage by imposing arbitrary and even flat-out ridiculous standards, limiting choice, canceling plans, and it's compelled almost every U.S. citizen to purchase private insurance with increasing premiums and deductibles. Imagine being fined by the government if you don't buy a $500 a month plan with a $6,000 deductible. By banning plans, shrinking the market, and increasing costs through taxation and regulation, providers began leaving the market due to unsustainability. This further drove up costs due to decreased competition. The Affordable Care Act didn't make care affordable at all. It actually drove up prices and made a bad situation much worse. In fact, I can't think of a single action taken by the federal government on such a large scale in my lifetime that's been a better example of blatant corporatism than Obamacare. And that's actually saying something. So now that we've covered the major issues with the current American healthcare system, part of the conversation needs to be dispelling some of the myths of universal or socialized healthcare programs in most major countries. We'll try to use Canada and the UK as examples in this comparison, again because we did this in the last video about drug prices, and those programs are most commonly used as comparisons to the system in the United States. So that's what we're going to go with. For starters, the idea that in the United States we pay twice as much for the same service and get worse results is simply not bore out by the data when actually comparing apples to apples. The United States absolutely spends more, but it's not exactly for the same services. For one, if we tackled the above-mentioned government-created disasters, we would see an extraordinary reduction in cost. But let's compare apples to apples with the current system and its failings. 1. In the U.S. as of 2019, we have about 4 times the MRI machines as Canada and approximately 3 times the CT scanners. This might sound like a trivial point, but it's relevant when we look at the difference in procedures and testing done in the American healthcare system to combat lethal illnesses versus other first world counterparts. This issue doesn't just affect Canadian healthcare, but it's a trend across Europe as well. Less testing abilities and longer wait times make serious ailments more likely to be lethal. The UK, for instance, has extremely low and declining numbers of radiologists and equipment for X-raying and CT scans. Second, the myth that in the US patients are treated according to money, whereas in countries with universal health care, patients are treated according to their need. This is not bore out by evidence either. Last year, approximately 4.4 million citizens of the UK were on a waiting list for non-urgent treatment, and about 3,000 of those had been on that waiting list for over a year. The goal of emergency care under the NHS is an expectation that 95% of emergency patients will be seen within 4 hours. However, that rate was actually below 80% last year. Nearly 80% of cancer patients have been waiting over 2 months to begin treatment in the UK. In 2018, despite having only 1/5 the US population, the UK saw approximately 30,000 citizens dying while waiting on a list for treatment. In fact, you're 4 times more likely to die at a top-ranked UK hospital than in the USA. In Canada, the average wait time to receive treatment is 3 times that of the United States. Emergency wait times in the US average around 24 minutes, which is actually 4 times faster than Canada. And waiting times for specialists in Canada is 6 times slower than the United States. So being seen according to need is not true in Canada or the UK. For cancer survival rates, for women diagnosed with breast cancer, nearly half in the UK will die. Around 1/3 will die in Germany and France, while only about 1/5 will die in the United States. For prostate cancer, the results for American men is about the same, showing about 1/5 will die, while 1/4 of Canadian men will die, and approximately half of the men diagnosed in the UK and France will die. In fact, for female breast cancer, colon cancer, lung cancer, and prostate cancer, the United States has a better 5-year survival rate than Canada, the UK, Germany, France, and Italy, according to the CDC. This clearly points to the results not being worse or even equal, but straight up better on these standards. For heart attack survivals, the United States beats Canada, Italy, France, Switzerland, the UK, and Germany. So let's look at the frequently cited 2014 Commonwealth Fund Commission comparison of healthcare in 11 countries, where America ranked 11 out of 11. And let's apply some of what we've covered. The objection stated by the Department for Professional Employees lists a lack of physicians as a medical issue in the United States, having 2.6 per 1,000, while the OECD average is 3.3 per 1,000. Remember earlier when I talked about the American Medical Association holding a government-granted monopoly on licensing and how this monopoly results in the capping of doctors? A mismatch of physicians state to state within the U.S., Massachusetts having significantly more doctors than Mississippi. Interestingly enough, Mississippi has the highest wage for physicians, and Massachusetts has the lowest. Mississippi has the lowest projected competition. Massachusetts has one of the highest, and Mississippi has one of the lowest malpractice payout amounts, with Massachusetts being the highest. Infant mortality is measured differently depending on country. Some countries don't even count babies under a certain weight criteria and at a certain level of premature birth to be born, rather stillborn, whereas the U.S. does consider them to be born. This affects the stats. But even then, in the U.S., it's only slightly higher than the other first world nations on the list, and the trends have been steadily decreasing. In fact, dropping from 6.7% in 2007 to 5.7% in 2017. As for the obesity rate, of course, it's going to affect health outcomes and costs, but obesity rates and life expectancy aren't really great metrics for judging a healthcare system as much as they're metrics for judging lifestyle choices among the populace. The United States is also far and away number one in terms of medical research and development of new drugs, which is utilized by these other countries. So we actually subsidize these other countries in drug creation and medical research. These other countries also exist under the umbrella of U.S. military defense, which is why they can afford to put so much of their national production into their welfare and healthcare systems. And I'm a relatively healthy, relatively young dude who's very fortunate in matters of health, but I understand that this is a huge issue, and that makes it all the more frustrating when it's not more of a major concern in mainstream politics. Republicans have no ideas, and they just wait to adopt whatever the Democratic position was about a decade after the Democrats make their move. But sadly, the Democratic move is to more and more government. It's amazing to me how many science-minded people just swallow some of this propaganda whole, to the point where I don't even hear mild criticisms of UHC systems from most leftists. All I ever hear is, it's better. Now, whether I'm right or wrong, maybe they are better. But that's not bore out by all of the data, and especially, there's no skepticism around this coming from people on the left that I am in contact with. Whatever your take, just remember some of the basics that I've covered here. We do not, I repeat, do not have a free market healthcare system in the United States. We have a highly regulated corporatist system. I'm not even suggesting that the government, or more specifically the politicians who've tried to mend this system and make it work, are doing it with bad intentions. Some of them, sure, because their ultimate goal is to have government control of healthcare. Some of it may be that way, sure. But there's an arrogance in politics to attempt to fix issues as if you know what all of the consequences will be. We've seen the consequences since the government got involved in the 1940s, and we've also seen the costs outpace inflation.